All right, ladies and gentlemen, we've all heard of superbugs, but now we have a situation in California at the Ronald Reagan UCLA Medical Center where up to 160 people may have been exposed, and we know that it has claimed 2 lives and infected at least 7 other people. Joining us now to talk about, well, exactly what it is and how it could be prevented from infecting others is Tate. Hello, Nick.
Hey, Steve. How you doing? Certainly bad news out of California.
Good. Very bad. So explain this to us.
Well, what they're thinking is that it was medical devices that are used, endoscopes that are used to track for digestive disorders, pancreatic disorders, and they were either improperly cleaned or the cleaning methods they were using, disinfection methods, were not effectively removing the bacteria as they used the medical devices on one patient and then went to another. There are now about 180, actually the numbers have gone up, about 180 folks who may have been exposed. 7 have been infected with this superbug. It's called CRE. It's hard to treat. It's resistant to antibiotics. And there are now 2 deaths. Unfortunately, we've been seeing more cases like this in the last couple of years at other hospitals, so it's raising questions about the effectiveness of the treatment and the cleaning of these devices, which are commonly used in endoscopic procedures.
Yeah, and you know, endoscopy is a very common procedure and could benefit a lot of people. How is it now that the recommendations, when they look at how they, you know, or the requirements or the procedures for cleaning these and sterilizing them, how could they not now be saying, well, you know, maybe they were inadequate and they didn't go far enough? I mean, it seems like the medical community would know how to sterilize something that goes down somebody's throat into their, you know, stomach. I don't know how they could give you wrong information at first and now have to revise it.
Well, it's very troubling, absolutely. The question is whether or not the manufacturing instructions for cleaning these devices was adequate. The hospital is saying that they were following the instructions from the manufacturers on how to clean and disinfect these devices, but for one reason or another, those infections were still happening. So one of 2 things is happening. Either that was not true, either the hospital workers were not following the instructions closely, or it's possible that this superbug has evolved defenses that allow it to survive those common disinfection techniques. And so now many hospitals that have had the problem with this superbug are going to different, more aggressive cleaning strategies that involve treating these devices with gases, which actually essentially sort of sterilize and autoclave them to a much higher level. But it certainly does speak to the larger problem of transmission of antibiotic-resistant bacteria and bugs in hospitals. I suspect we're going to hear many more cases of this in the months to come.
Right, and this, I'm sure, is not limited to this hospital, and I'm sure, as you alluded to, it's not limited to endoscopies. You know, there are colonoscopies, there are all kinds of invasive procedures where equipment and tools are used and facilitated. So there's probably a laundry list of things that now are suspect.
It's absolutely true. In fact, you may recall there were problems at VA facilities where colonoscopies, the devices used in colonoscopies, were spreading infections as well. So I think you're right. I think this is a trend that we're seeing. It's a troubling trend. There have been outbreaks like this involving hospitals in 47 states to date. There have been at least 150 people who've been infected since 2012. More than a dozen have died. So in the meantime, really the best thing you can do if you are going to a hospital for a treatment, you need to talk to your doctor about whether they have seen this particular infection. Again, it's called CRE. Have they had evidence of it in the hospital? What are they doing to clean these devices? And are there other things that the hospitals, the doctors can do to make sure that they're really taking these aggressive steps to combat, contain, and prevent these bacteria from infecting you?
Yeah, no, it's a very scary scenario. On one hand, people who need these tests and could benefit from these tests, like colonoscopies and endoscopies, et cetera, shouldn't be scared away. But on the other hand, you know, you gotta look at all the pluses and negatives. Like any kind of elective procedure or elective surgery, there's always a risk, but this shouldn't be one of them. You would think they would figure out how to clean these things, but we shall see. Nick, thanks for educating us, and appreciate your time.
Thank you, Steve.
All right, Tate, ladies and gentlemen. And you can learn how to survive the baby boomer financial crisis, by the way, with the newly released book, Da Vinci's Baby Boomer Survival Guide. And do that by going to babyboomers711.com. That's babyboomers711.com. It's as simple as that. All right, ladies and gentlemen, a little mixed day on Wall Street. We'll get all the closing numbers and the explanation with Jeff Yasteen. He's up next right here on the Closing Bell Report. Don't go away.